Today we're going to talk about urinary incontinence in men, and that means having urinary accidents, urinary leakage in men. Specifically, we're going to talk about urinary incontinence after prostate surgery or prostate radiation. And specific to that, we're going to talk about a procedure or a surgery that can really manage this issue. There are different reasons for urinary incontinence or leakage in men. Sometimes patients have a lot of urgency, frequency, so when the bladder fills up and reaches a threshold, it just causes the bladder to spasm, and before the patient can get to the bathroom, they have an accident and they leak. That's urgent incontinence. The other kind, which we're going to focus today, is when there is a leakage after prostate surgery, being for benign disease or prostate cancer, or even after radiation for prostate. And that's when the sphincter cannot hold against urine. So patient coughs, or they're walking, or they're doing any activities, the bladder just starts leaking, either dribbling or having a flow, and a patient can have an accident. So here at Houston Methodist, we actually really personalize treatment and management for urinary incontinence. We work very closely with our oncology colleagues, and right after surgery, we see the patients, and if they are bothered by urinary incontinence, we try to come up with a plan that is specific for that patient's goal and expectation and their needs. First of all, I do have to emphasize that this is not very common. It does happen very infrequently, but it can happen. When it does happen, we start working with the patients right after surgery. There is a period of recovery for about 6 to 12 months where we do non-invasive interventions such as pelvic floor physical therapy, and we help the patients regain their control over the urinary continence that they have. If that is not achieved after 6 to 12 months, one of the procedures that we commonly do use is artificial urinary sphincter placement. Artificial urinary sphincter is an implant, kind of like when you go get a knee replacement or a hip replacement surgery. This is an implant that we use to replace the sphincter that's not functioning well. It's very small though. It's much, much smaller than the knee or hip replacement, and it's much easier tolerated. The surgery is smaller, shorter. The recovery period is much faster. Basically, if you want to imagine that this is the bladder and this part is the P-tube or the urethra, what's happening is that when patient coughs or sneezes, the sphincter that sits around here is not working as well. So what we do is that we use this very small implantable device. Houston Methodist is actually a center of excellence for this procedure. We've been doing this for a very long time. This device has been around since the 70s, and it's really the gold standard. It's the only format that is used nationally and internationally. So we do have a lot of experience in implanting it, revising it, and using it. The way it works is that there's a little pillow that we fill up with saline or fluid, and then we'll wrap this around the urethra, the P-tube. So when it's full, you have this coaptation, this closure, so urine doesn't leak, there's no accident. When it's time to urinate, the patient pushes this little tiny little button that's in the groin area, and that would deflate this cuff, and then the urine will flow through the urethra, and then automatically it will just fill up, and it would help with continence. So let's talk a little bit about how the surgery is done. This is actually almost like a day surgery. Many patients can even go home that same day. If the patient wants to stay overnight, they can stay overnight and be watched for 23 hours. But it's a very straightforward procedure. Small little incision in the abdominal area and a small little incision in the groin. We would implant the device, let everything heal for about a month, and then patients return to our clinic. We will turn it on and teach them how to use it. It's a very intuitive, simple, mechanical device, so almost all patients learn pretty quickly over a day or two of how to use it and how to be comfortable with the device. I would say after 6 weeks of implantation, patients would be pretty continent, and they may only need to use a liner for security measures, but otherwise they would have a really good control over their urination. Usually they also need to avoid any heavy activities or any heavy lifting or any strong activities for a few weeks after surgery. So it's not a really big surgery. The device lifetime is actually about 8 to 15 years. If a part of it fails, let's say the cuff or the pump, we can actually go in and target that part of the device and just revise that part and replace that part. If the whole thing fails, then we'll just replace the whole thing. Interestingly enough, patients who do regain their urinary continence after being incontinent for a little while after prostatectomy, they're just so happy because they used to be continent, they used to be completely fine, go play golf, do their activities, do their yard, and then they had their surgery and now they're incontinent, they have to carry pads and pull-ups, and then all of a sudden, literally within a month, now they have their life back. Now their quality of life has significantly changed and they regain their continence. They can do the activities they enjoyed without needing to carry pads and pull-ups or have accidents. I think there's been a lot of work and a lot of research that's been done in improving the procedures that we do, so we have actually less and less urinary incontinence. When I was first in training, we had a lot more urinary incontinence after prostate surgery because we were doing those open. Now we do them robotically. We have amazing views to do nerve preservation, better procedures, small little techniques that the oncology surgeons are using to improve continence. So first of all, I think we're going to have less and less of this issue to deal with. And then secondly, as reconstructive surgeon, reconstructive urologists, we are also trying to make these devices easier and more intuitive for patients. So there will be next generation of these devices that will even be smaller or easier to use. And I think finally, when we put everything together and we put our patients' health and patients' expectations and desires at mind and we personalize our management options for them, this is actually something that as a team approach, the urology, oncology, and the reconstructive urologists, we meet with the patient early on and we work together to come up with a decision, with a plan that is shared with the patient's desires. So moving forward, we can adjust our steps in gaining control for that patient that fits their needs.